Hello again, I'm Dr. Attia, and we're going to talk about one of the techniques that we use in our office known as Grostic. Grostic is an upper cervical specific type technique developed by Dr. John Grostic in the 20s, I believe it was. He practiced here in Ann Arbor, as a matter of fact. Put together a fabulous, reproducible type of technique. We use this on most of the patients that we have in the office, but it's really good for migraine headaches, ADD, ADHD, Alzheimer's patients, people with neurologic disorders, post-stroke and things of that nature, autism. As a matter of fact, there was a study done not too long ago at the University of Louisville, I believe it was, where they used this particular technique only, no changes in anything else, for children with autism. 85% of the children did improve on their scores. So the technique itself is really sound. It has a lot of history, and it's backed up by a long time of proven results. On the x-rays here, I don't know how well you can see these lines, but when we do the x-rays on a patient, I draw these lines out here to determine the position of the first vertebrae, known as the atlas, which is right here, in its relationship to the skull and the lower spine. Now, this particular lady that these are x-rays of does have quite a distortion in the upper cervical region here, and her symptoms are loss of balance and ringing in the ears, a buzzing in the ears. There may be some other issues associated with that also, but that's primarily her symptoms. In order to make the adjustment with this type of work, and I know this looks like a drill, I'm not going to put a hole in anybody's head or anything like that with this, but from the angles that we get from the x-ray analysis, I will adjust the patient as they're laying on their side, and just a few ounces of pressure, okay, in order to move this vertebrae. I find in most cases less is more. This technique is extremely passive, but highly effective. I'm getting some literal miracles with this particular technique. So we use this on most of the people that come in, but especially for chronic migraine headaches and other neurologic disorders. So thank you.